My primary role is as a occupational health nurse on a gold mine. It's quite a complex job. It's not like any other job I've ever done. Some of the community work that we do, we assist RFDS through transport, communicating with patients when they're not here and liaising with patients, and also keeping the treatment going in between RFDS visits here. RFDS doctors and nurses are probably the best clinicians I've ever worked with.
Greg is our person on the ground. We've developed a relationship, so he's phoned me up with people with heart attacks from the mine, and we do 24/7 calls. So when you get him on the phone, you know where you're coming from, you're able to give advice, organise retrievals. It's a small community, mainly elderly people, several hours from nearest medical help, and effectively Greg and the nurses here are the first port of call if they've got any health problems. He is an experienced practitioner. He knows his job. He's very capable but very gentle, doesn't panic, gets the message over to us well, gets on well with the people in the town. They like him. They're very lucky to have him.
Greg used those few minutes that I went in for a random drug test to talk to me about something that was life-changing. It was just a normal morning. I came through to do my breath test. I stepped into the nurse's office and Greg just really quietly pulled me aside and very politely said, "Have you ever had your neck looked at by a doctor?" I said, oh no, what do you mean? What's wrong? So I had a bit of a chat to him about it and he said, oh look, I suggest you go see a GP if you haven't got a good one, or I can recommend one to you who does a lot of thyroid work. When the doctor said cancer, you sort of go, oh, okay. This is another level. What does this mean? And I think it's really hard not to sort of panic and go to worst case scenarios in your head. But it was just amazing going through that process and not really realising the weight that I felt until the doctor said, no problems, you don't need any more treatment, you're fine. It was just literally like a weight lifted off my shoulders and that I didn't realise was there. And it was at that point that I sort of sat back and kind of took stock of the whole process and thought, wow, I'm just so glad that got picked up when it did.
She's a special person in that she shows a lot of courage that a lot of people don't have. It's actually very satisfying to know that I've actually made the difference.